Okay, so here we're going to be talking about what kind of initiates depolarization in the SA node in the cardiac cycle. So remember that our pacemaker is also called our SA node. So that's kind of our pacemaker. And so how this starts the pace, I guess, and spreads this depolarization throughout is it first starts with these HCN channels, or our funny channels, and specifically the hyperpolarization of them. So that's important to note that it's not depolarization, which we typically have, but it's hyperpolarization. So once we get that hyperpolarization, then our sodium enters through those HCN channels. And these HCN channels is important to note that they're expressed on the SA node. But so when this sodium enters through these HCN channels, then you have a net depolarization. And we can see that over here. We originally see this first hyperpolarization where it goes down. And then because we have so much sodium coming in, it's a net depolarization and it starts to increase. So then we have our calcium entering through our transient channels. So this just allows for further depolarization. Once we have that further depolarization, we see that it can reach this threshold through the long-lasting calcium channels. And so these are basically just slower to inactivate versus the T-type, which we see up here. So they're slower to inactivate, which is what allows this to rise and rise until we reach our peak. And so then we have our our potassium channels that open with delay. So this causes repolarization. And that's when it starts to come back down over here on the chart. And then we repolarize our cells and our potassium channels close. And then after these close, then they will get hyperpolarized and our HCN will open again and it will repeat. And so that's kind of the cycle, how the spread charges, or the charge spreads. And so as we move down here, this is a great kind of diagram here to help see when our channels are open. So we see that we have our sodium channels, which is just open at first. So these are kind of our first ones. And then we have our T-type calcium. So these are that quick kind of to inactivate. Then we have our long-lasting ones. So that's what allows that big depolarization. We can see that kind of aligns with the peak there, kind of. And then we have our potassium channels that open last.
All right, and then over here we have Ohm's law. So this is a law that just allows the voltage to be related to the current or the resistance. And so what this says is that the voltage is proportional to the current, which is I, or the resistance, which is R. However, current and resistance are inverse as each other. So I kind of wrote it out here. You can see more voltage means more current. They're the same, so if you increase one, the other is going to increase. However, the resistance and the current are opposite because they're on the same side of the equation. So if you increase one, you'll decrease the other. And this is just a good law that allows resistance and current and voltage to all be related so that they can be calculated.
And then as we move down here, we have the other 99% of our cardiac cells are going to be ventricular, and they're going to be just myocytes. So kind of how these work is it's going to have their rising phase, which is going to be at sodium. So this results in the long-lasting type of our calcium to open. So right here we have where our sodium enters, that depolarization, that quick rise. We see how high our movement of our ions goes there. And then we see that our plateau, we have our calcium and our potassium channels are going to be open. And we see that plateau right up here, how it kind of stays open for a second. That's because these calcium channels are open and these potassium channels are kind of more closed. We have like a less of a net movement of that calcium out. So it stays open for a little bit longer. And then we have our potassium channels. That's going to have that delayed opening. Like I just said, they're going to open right here to allow that to repolarize up here. So yeah, we have a few different kind of actions going on, but these two charts are super helpful to be able to compare when our gates are open and closed.